Everyone smiles in the same language. But a dimple on the cheek surely steals your heart straight away, isn't it? A dimple cheek can make you smile 1,000 times more adorable, can boost your confidence and make you center of attraction in a crowd too. But everyone is not so lucky to have these on their cheeks. Only about 1/5 of the population have them naturally. Rest keep envying these dimple beauties. We all know how we gush over the dimples of our Indian film stars like Shah Rukh, Preeti or Alia. Hello friends, I am Dr. Ashish Khare, Senior Consultant Plastic and Cosmetic Surgeon at Kalosa Aesthetics. I practice extensively at Delhi and Gurgaon, and in this video, I will tell you why you should stop envying others for their dimples, but get a permanent one today for yourself, owing to short OPD-based surgery and with beautiful outcomes. Let me also remind you about my YouTube channel Kalosa Cosmetics. Please subscribe to it to receive regular updates about plastic surgery videos. You can also visit our website kalosaaesthetics.com and kalosa.in. Do you know that a dimple is a natural deformity on our cheeks? Well, I never knew that when I was young. Yes, a dimple can happen naturally if the skin gets wedged down to the underlying connective tissue, and it is actually due to the defect in zygomaticus major muscle. As I told you, only a few % of population is born with that deformity, but it is truly blessing in disguise. Now, if you also want to have those tiny attractive features on your cheeks, consult a plastic surgeon today. Anybody above 18 years of age can opt for this dimple surgery. It's a daycare surgery, can be even done in a lunchtime break. You should be clear in your mind whether you want a unilateral or a bilateral dimple on your cheeks. A right placed dimple does have a positive impact on your face and boosts your confidence. What to expect on surgery day? The procedure is preceded by putting marking on face over the site of the desired dimple. Usually, patients tell me, "Doc, I want Shah Rukh's long dimple or Preeti's single dotted dimple." Well, I have to take into consideration this all as well. I show my patients the best anatomical position where a dimple should be actually. There is a particular area in the cheek where there is no statistically significant nerve or blood vessels. And of course, you have to be careful about salivary gland as well. I mark it and confirm from them if they are liking it. A lot of time, people think that dimples should be much higher in the cheeks than they really are. But these are actually not safe areas. And if you go lower, it won't look good. Well, talking something about the surgery is usually done under local anesthesia. That means you would be all awake during the procedure. It is a completely scarless surgery as incisions are made on or inside the mouth. A dissolvable suture is placed to connect skin to the underlying muscle called the buccinator, hence creating a desired dimple, and it usually takes 30 minutes to 45 minutes for the whole of the surgery. What are the challenges usually I face when the people present me for a dimple correction surgery? People who have thicker skin, people who have a lot of fat in their cheeks, they tend to have a harder time getting a really good dimple. But having chubby cheeks, we combine dimple creation surgery along with the buccal pad of fat removal. Are there any worrisome complications of the dimple procedure? Not really. Some swelling and bruising is expected post-surgery, which gradually subsides. Pain and infection are usually taken care by a set of oral antibiotics and anti-inflammatory drugs, such as involved inside of the mouth. Infection can happen if not taken proper care. We always tell our patients to have a proper betadine wash and maintain a good oral hygiene. Hot liquids and milk products should be avoided for some time. Also, sometimes dimple may not turn out to be as deep as previously desired. These of course need enhancement surgeries later on. Something about the recovery time. Well, when we create a dimple, a static dimple would be created immediately. That means a dimple would be there even when you are not smiling. But tethered skin will slowly release and scarring between skin and the muscle would create a permanent dimple. Final dimple would then be appreciable only on smiling or laughing, and this would be completely natural looking dimple. After a month approximately, recovery would be complete. So friends, nothing can be more simple than getting these dimples done. Make sure you visit an experienced plastic surgeon for this. And let me tell you, dimple creation surgery is already a rage among numerous youngsters, and I feel very satisfied to give them their happiness through this short surgery. It is equally gratifying for me as a surgeon to do this surgery as for the patient themselves. Let me also remind you about my YouTube channel Kalosa Cosmetics. Please subscribe to it, receive regular updates about plastic surgery videos. You can also visit our website kalosaesthetics.com and www.kalosa.in. Thank you.